Welcome. Today we are going to talk about drug abuse and addiction. To begin with, what substances are abused? They are classified into three: the depressants, the stimulants, and hallucinogens. The depressants include alcohol, opioids, and benzodiazepines. The stimulants include cocaine, nicotine, cat. Hallucinogens, we have cannabis or marijuana, magic mushrooms, and ketamine. But why do people initiate drug use? What are the key motivators? One, people want to have fun or the pleasure that comes with using drugs. These are kids on campus who want to have a good time. They're going to smoke a joint or they're going to have a beer. Two, individuals want to forget or they're going through pain and want to use this drug to actually get over the pain. Quite a number of people, when they're depressed, they end up in the bar having a drink because they want to forget the pain. Functional or purposeful. Some individuals start substance use because they had to use it, for example, opioids, to take away the pain, but eventually they get addicted to using them. Also, initiation starts through experiment use. You go read about something and about a drug, or a friend tells you, and you want to have a puff on the joint. You want to experiment. The peer pressure. You're hanging around your friends and they're drinking, and they say, you know what? No. You should start. Take this gummy bear or take a smoke. Then you start. But how are these drug users classified, or what are the types of drug users? To begin with, we have experimenters who just use a drug to find out what it is. So it's this time you're out with your friend and tell you, oh, just have a puff. You experiment. Then you have social users. These are individuals who tend to use a substance in a social situation, like they have a drink during a social gathering once in a while. Then you have regular heavy users. You have these people who are actually going to have a drink every day after work, and they have more than one drink. Then you have the dependent users. This is the extreme, where these individuals can't do without the drug. So what do these substances do? These psychoactive substances, they alter the person's mood. That's why when someone says they've taken a beer, they feel good, everything seems to be nice. They've taken a joint, they feel happier than usual. They alter your cognition, how you think and how you look at things. And behavior. When a person is drunk, they're going to stagger around, they're going to do things you don't expect them to do. But what problems are these drug users faced with? To begin with is intoxication. When you take a substances, you are going to get drunk, you're going to get high, and you are going to be intoxicated, and you're going to behave in an abnormal way. Once you're intoxicated, you're going to drink and drive, and you're going to crash your car. Injuries. Poisoning. You've seen people who tend to vomit after taking large amounts of drinks. That's a way of the body getting rid of the poison, which is the alcohol. Hangovers. People have had a drink, the next day they can't do anything. They cannot work. Absenteeism. Because a person has had a roller coaster at the previous night, the next day they cannot go to work. High risk behaviors. Drugs tend to excite persons and they get discouraged to do things they wouldn't do. They tend to have unprotected sex. Then the regular or excessive users, what happens? They have health problems. Because of the drugs, the alcohol, they tend to give you health problems. They bring financial problems. These drugs, you use money to buy them. This causes individuals to become broke. Relationships and child neglect. Individuals, because they are using substances, they don't pay attention to their spouses and they neglect their family. And of course, independence users. These individuals, of course, have impaired control. The drug takes center stage of their behavior, of their mind. They can't do without the drugs. Behavioral isolation and social problems. They also tend to have withdrawal symptoms and psychiatric problems, on top of health problems, liver disease, so on and so forth. But what is drug addiction? Addiction is a brain disease. It's very important to know that it is a brain disease, and it is chronic and relapsing in nature. So drug addiction is a complex illness. It's characterized by compulsive. You're compelled to keep using these substances, and at times uncontrolled drug cravings. You find the individual, he cannot do without the drug. He will do everything possible to get the substance. He will solve all the properties. And all this persists even in the face of extremely negative consequences. Yesterday you drank alcohol, you crashed your car, but the next day you're still going to use the substance. And these individuals who are dependent or addicted to substances develop tolerance. Initially, you used to take 2 beers to get the effect, but you can no longer take 2 beers. You want to take 3 or 4 beers to get the effect. The other one is withdrawal. So these individuals, because drug use being a brain disease, the body has gotten used to this drug, and the brain has been rewired. And once you withdraw the drug, you have psychological effects that we are going to discuss. So why do people use drugs? Of course, people use drugs because they like what it does to their brain. It activates the reward system. The reward system in the brain is manned by a chemical called dopamine. So whenever you take a substance, it rewards the system. There's production of dopamine, and different substances have a different spike of dopamine. Things like cocaine have the biggest spike of dopamine. When you eat food, it's a reward system. You get dopamine released. So all these work on the reward system. But why can't people just stop the drug use? Why? Why can't you snap out of it? This is because prolonged drug use changes the brain in fundamental and long-lasting ways. Because your brain has gotten used to the reward system being activated all the time, it has been rewired. The neurotransmitters are being produced. The receptors are responding differently. So you cannot just wake up and stop the drug use. You can snap out of it. If you could just snap out of it, why are rehabs so full in the world? But how do we manage the drug use or addiction? 2 steps. One is detoxification and the other one is rehabilitation. Detoxification is carried out in an inpatient basis. This is because we are replacing the substance in the person's mind, and we monitor how it's done. So for the first week or so, for example, in alcohol, we undergo detoxification, and it's called replacement therapy. We do not just remove the alcohol. That's why these individuals, normally when they stop drinking, they have withdrawal symptoms. They have seizures, they are breathless, they are shaking. And they tell the doctor, if I don't have a drink, I can't do anything. So in rehab, we shall detoxify, clean the system of the alcohol as we do the replacement therapy. And of course, the longer part of the treatment is rehabilitation. During rehabilitation, we have a lot of therapy sessions where we teach them about the substances, the dangers. We teach them how to live with the substances. We teach them how to go back to the community and work without the substances. This takes a bit of time, and as the individual is ready to go back to the community, we release them. In the next episode, we shall talk about mental illness in the elderly. Thank you for watching and prioritizing your mental health.